Welcome to Conversations with the Winners. I'm Jacinta Goda, and I'm here today on behalf of the Robert Wood Johnson Foundation. Today, our conversation is with Teresa Molina and Javier Alegre with the Latino Behavioral Health Services in Salt Lake City, Utah. They are winners of the 2021 Robert Wood Johnson Foundation Award for Health Equity. Welcome, Teresa and Javier. Javier, tell us more about Latino Behavioral Health Services.
Sure. Latino Behavioral Health Services is first and foremost a community-based organization and a 501c3 nonprofit that serves the Latino and Hispanic community in Utah since 2013. Our services are Latino-led and provided, and culturally responsive and language specifics in a way that is accessible and available to the Latino community across the state of Utah.
When we've talked before, I think this phrase, making behavioral health culturally responsive, really is a signature of your organization.
Yeah.
Teresa, talk a little bit about what that means.
Well, to me, this is professional and personal, has to do with language and culture. We look for to provide an environment in which we are having representation in terms of providers, in terms of peers, in terms of equals, and that it is for Latinos, by Latinos, bridging that whatever gaps happen when you are speaking about different cultures in a society like the United States.
Javier, you want to add to that?
Having representation is very important. Oftentimes we go to seek help, whether it's medical or otherwise, and we don't see ourselves represented in the providers or the spaces we walk into. And that creates immediately some sort of a fight or flight response on us, where we are more guarded. Are they going to understand us? Are they going to know what we need? Are they going to understand our history, our historical trauma, our vicarious trauma, and all of those elements that a person from South America, any country in South America, would have somewhat of an understanding of what each other go through or what we have gone through. So that for me, when we try to say we are culturally responsive, is because we have a common denominator in our history, in our upbringings, in our beliefs, in our spiritual understandings or religious beliefs.
You told us earlier about this peer-to-peer model and how it is different. Teresa, why is that important, this peer model?
Peer means close, like similar. It means common experiences. So a peer model means helping others through our lived experiences.
I think it's important to acknowledge that there is a complex trauma situation and there is the need for a more intense way of approaching that participant or that client. And to circle back to the peer model, the effectiveness of the peer model is that we share those experiences with other individuals. And as a community, and more so indigenous people practices incorporate community in the recovery and well-being of one another.
Your award is related to systems change and building health equity through systems change. Teresa, tell us about the systems change, if you can identify those aspects that really course corrected the system for your clients?
Through bridging the language, we created a movement in which we brought together people from different organizations, people working with child welfare or family welfare, with health services, with education, teachers, administrators, university personnel, staff, students, faculty who wanted to help the Latino community. Initially, we were very mature, old individuals who wanted to see a change and to find resources. And then we realized we had to create it. We have to create the resources because the resources were not out there. And when younger generations start joining, they said, let's become visible. And they started going to school. So when the pandemic hit, we were the human resource among other organizations for state agencies to connect with the community. And that just spread and spread. And suddenly the many fields in health services, in mental health, psychiatrists, social workers start like, oh, this organization seems to be doing well. Well, this organization seems to be creating something different. So I was able to bring, for the first time, the peer support specialist training in Spanish, taught in Spanish by Hispanic people with cultural and language component that is irreplaceable. We need to change the system even further. So everything related to mental health, everything related to behavior, it's a matter of communication.
Javier, you also mentioned earlier about this being a social justice issue. Can you talk to us about that?
How much time you got?
Not a
This is a conversation that I'm very passionate about, that I spend a lot of time. It's difficult because we tend to see equity as equality, and equity and equality are two different things. But when you take under consideration things that we have talked about today, like historical trauma, underserved communities, marginalized communities, a man that grew up in the mountains speaks mountain language, right? That individual knows how to communicate with his environment, and his environment is very rudimentary to us, maybe, or to a 20-year seasoned experienced psychiatrist is not going to understand what the person is talking about because it's an entirely different environment. So when you say that we have a one-size-fits-all system that is equal to everyone, that doesn't mean that is equitable. That's the opposite of equity. So social justice boils down to, are we providing the same opportunities for everybody? And if you ask me, I say, no, we're not.
What did winning the Robert Wood Johnson Award for Health Equity mean for you? I'll start with you, Teresa, on this question.
This award comes along also with the Campus Community Partnership for Health. It's a partnership of Robert Wood Foundation, right? So for me, it is the opportunity to help system change, specifically for this piece, the education that universities are providing, because that means the future workforce, the future of providers, how well equipped they are going to be for serving the community they may be coming from or not. For me, this award means the recognition that we are doing it in our little way, a system change.
A significant way, I would say. Javier, what does it mean for you?
You know, working in this field, especially on the social justice and EDI, equity, diversity, and inclusion, is a very finicky world, right? It's not necessarily, you don't get recognition or thanks very often. But it also gives us the opportunity to say there are other ways. There are other possibilities for systems to serve communities. And with that being said, because it is such a recognized foundation and a tremendous honor, it gives us somewhat of a leg to stand on, so to speak. It's just like, listen, we are making change. We are being recognized. We might not be ahead of the game or as far as we would like to be, but let's pay attention to what some of us are doing because it's impactful, it's important, and it's saving lives.
Javier and Teresa, I want to thank you for sharing your insights with us. And on behalf of the Community Campus Partnership for Health and the Robert Wood Johnson Foundation, congratulations on your award.
Thank you so much. I appreciate the time. Great talking with you.
Thank you very much, Jacinta, and all the technical support that we had.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2021 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Goda, and thank you for watching.